Tēnā koutou katoa. E kore au engaro he kākano I ruia mai I rangi Aotea. Kia ora tātou. Ko rangi nui e tuiho nei, ko papa tuanuku e takoto nei, tēnā kōrua. Kia rātou te hunga mate, haere, haere, haere atu rā. Kia tātou ngā morehu o rātou mā, tēnā rā tātou katoa. Tātou ngā tauira o tēnei hui, kia ū ki te kaupapa, kia kaha te kōrero, kia manawa nui. Tēnā koutou katoa. Ka ingoe tātou. Tūtawa mai I runga, tūtawa mai I raro, tūtawa mai I roto, tūtawa mai I waho. Kia tau ai te mauri tū, te mauri ora, ki te katoa. Haumi e hui e,
Tāhiki.
Tēnā koutou katoa, ko mere ana te piri ahau, he uri ahau no Ngāti Rangi Nui, Tapuika me Waitaha. Tēnā rā tātou katoa. Kia ora everyone and welcome to our Webby Shop today, how Aotearoa is shaping World Health Promotion. On behalf of the team here at Health Promotion Forum, we'd like to formally thank you for joining us. This is our final Webby Shop for this calendar year. It's fast approaching Christmas, so we thought we'd wind up with kōrero on how Aotearoa is shaping World Health Promotion. So thank you for taking the time out from your busy schedules to join us today. So I'm Miriana. I am the Māori Health Promotion Strategist here at Health Promotion Forum, and I'll be your MC for today. So today's style is more of a kōrero and kickback style format today. So it's not a presentation. We really want you to join in on the discussion and take your time to ask our panelists some questions. So a big kaupapa for today is also indigenous health promotion. That is a big push for the future, what we're trying to really reinforce here in Aotearoa and globally as well. And we want to invite you to be a part of that as well. Yeah, listen out for that stuff. So just a few pānui before we get into meeting the panelists and the discussions. So first of all, I just want to do a few welcomes. So welcome, we've got quite a few organisations with us today. So kia ora to Age Concern, Cancer Society, Auckland Regional Public Health Service, Te Hiringa Haura, Salvation Army, Lifelinks, Tui Ora, Well Women and Family, and I think we also have Nelson Marlborough DHB from the Te Whatu Ora whānau. So thank you for joining us today. We do ask that you send your evaluations to Emma Frost and keep an eye out in the chat for the different links to that as well. Kia ora Donna from AFS, kia ora, kia ora. All right, we and also for all you shy lot out there, we do ask that you put your camera on for the whānau photo at the end, just before Christmas. So we will be taking a photo near the end of the session, and we ask that you do show us your beautiful face for that. So if you're currently hiding your camera, you've got a good 40 minutes to do your face up if that's what you feel like doing. All right, quite a lot to get through today, whānau. So keep an eye on the chat throughout the session. Lots to share, lots to get through as well. The format for today, like I said, kickback and kōrero style. Our two panelists, Sione Tuitahi and Viliame Puloka, you don't often get to nail them down these days, so I do encourage you to speak directly with them if you want to, because they are a wealth of knowledge and they are hard to get these days. They're in high demand, so take your opportunity while you can. Kia ora Well Women whānau, kia ora Vanessa and whānau from there. What else do I need to tell you? We have 4 sections today. So we are going to quickly go over health promotion, just as a brush up for anyone. A big push for Indigenous health promotion. If you are Indigenous, please keep an eye on the chat because we're going to be we're recruiting for members for our Indigenous networks. We're going to talk about planetary health, and we're going to talk about present and future health promotion needs. So lots to keep track of, and I'm going to do my best to keep us on time, crack the whip and let us get through it all. And lastly from me, if you have any questions, and we do encourage you to have any questions, or if you would like to kōrero, just put your question in the chat. We can ask it on your behalf, or we may get you to ask yourself so you can have a kōrero with Sione and Viliami yourselves. So yes, don't be shy, whānau, do not be shy. Okay, that's all the formalities out of the way. What I'm going to do is I'm going to introduce our two speakers. If you don't know them, you should know them. So the first one we've got is Sione Tuitahi. He, of course, is our CE here at Health Promotion Forum. He wears lots of different hats, very high hats. The most recent one is the president of the IUHPE. So that is Sione Tuitahi. And we've also got my second favorite, my other favorite Tongan uncle, Viliami Puloka, ex-practicing surgeon and current almost professional opera singer, Viliami Puloka. And he was also working with University of Otago. So I'll get Sione and Viliami to introduce themselves before I start asking you the hard questions. Ka pai, is that okay, Sione and Viliami?
Thank you, Mariana. Kia ora tātou whānau. I'm Sione Tuitahi, as Mariana has introduced. It's a pleasure and it's a bounty to be here. Looking forward to our kōrero, our conversations this morning on this very big, high-level topic. But look forward to tackling that with your contributions. Back to you, Mariana, or maybe pass it to Viliami.
Thank you, Mariana, and malo Sione, and malo lele to all of you who join us today. I think it's wonderful for all of us to come together and have a hui like this. Then we can have kōrero just before we break up for the year, knowing that we have been through together such a difficult 2 years, or at least. And I think we were all in the same boat. So I think, in a way, we have a lot of experience that are common to all of us. I welcome all of you and looking forward to talk to you and share some ideas. Malo Pito.
Malo Sione, malo Viliami. Thank you. All right, we're going to get straight into it now, into our first section, which is health promotion. So we've got a couple of questions here. First one, can either of you please give us a very simple breakdown of what health promotion is in a nutshell?
I'll go first, then I'll leave the complex part to Viliami, Mariana. But just to touch up of our understanding of health promotion. Firstly, health promotion as a notion, as a concept, and as a practice, it's actually present in all cultures. This notion of well-being, and for us to look after our well-being. For health promotion to become an academic, topic, to be more formalized, it came from Europe, of course. But here in Aotearoa, for example, to note my first point, that it's present in all cultures. We have Māori health promotion, the notions, the principles of tapu and noa, of hauora, not only of human being, but also the environment, and how we ourselves are taking the lead and charge in promoting our well-being, holistic well-being. I'll stop there and I'll hand over to Viliami to add on a Pacific flavor, perhaps.
Yeah, thank you, Sione. And I think health promotion, we hear a lot about talking about health promotion and health education. They are components of each other. Actually, health education has been the mainstay of public health, but the focus was really on education. Once there was a time when we thought that the solution for everything is education, meaning that the reason why we have problem because we do not know is the knowledge, lack of knowledge. But then we realize, especially doctors, medical doctors, and I'm one of them, they have lots of knowledge, but still they fail to reach good health status and things. So there was a realization then, actually it's not, the issue is not the lack of knowledge, it's the ability to move from knowing to doing. And therefore the focus has moved away from focusing on teaching the individual, trying to fix the individual person, rather to a more holistic and to a community, more group level. And the idea is that everyone, you have all the goodness in you, and all the health promotion is to reactivate, encourage, empowering, moving you from good to best, moving you from good to great, as they used to say. So it is really encouraging and empowering all the goodness that's already in you. It's not teaching you something new, but to begin from where you are. So that's really what health promotion is. Health promotion is really empowerment. It's the art of encouragement. And then, you know, health promotion, you have all the things that you can read about, all the different approaches that you do. But in the main, when we talk about health promotion, we talk about the art of encouragement, empowering, and allowing the individual and the community to be in charge of their own health and well-being.
So Miranda, just to add two last points to what William has elaborated. You know, the Ottawa Charter definition of health promotion, you know, the process of enabling peoples and communities to take greater control of their health and the determinants of their health and well-being. And the final point for me is that health promotion is, you know, sits in a continuum of health and well-being and health care. On the left, the starting point is health promotion and public health, and on the right is personal clinical health. If we do well on the left-hand side, where public health and health promotion, you know, sit, we will spend less money on the right-hand side and less visits, you know, to the hospital and the medical doctors and all of that. So they complement each other, those two major parts of our healthcare system. But it's very clear around the world that, you know, health systems and governments are overwhelmed, not only by diseases, as we have witnessed with the pandemics, but also in terms of financial costs and workforce and capacity and all of that. So if we focus more on the promotion, prevention, protection side, there'll be less and less cost and time and resources on the clinical treatment side. And New Zealand is certainly heading towards direction. The reform that we are going through is more about working with the communities first and foremost, rather than, you know, working with them through diseases and they come out at the other end and end up at the hospital. I thought that I mentioned that and bring health promotion more closer home, you know, and highlight its efficacy and significance.
Sione, maybe I just add one little point there. I think it's very important for us, because all we're talking about here, we're talking about health. And, you know, the WHO has defined health as a state of well-being, physically, mentally, and socially. But so as if that you are living an unhealthy life, and then all in a sudden you get to a point where you become healthy. I can current you, I never met anybody who have complete wellness as being defined. From the health promotion perspective, health is not a destination. You don't travel unhealthy, and health is whatever. Health is a resource to do life with. Whatever your status of health, as broken as you are, that's where you need to begin and progress from there. So don't wait until you get good health and then you do something. So I just want to just to add on this, from the health promotion perspective, health is not a destination, rather it's a resource. And whatever status, wherever you are at this point, that's all you have got. So you progress from that. And if there are things to be improved, if there are things to stop and there are things to do, that's what health promotion encouraging you to dig in to the goodness that is already in you and progress from there. Malo.
Kia ora kora, thank you for that. So I'm going to move on slightly from there, because you know, you did talk about high level. So so for lots of people here today who are on the ground doing the mahi, we have to come out of our day-to-day role and look at, okay, I'm not just, you know, I work in the cancer society, you know, I work in the cancer field, or I work in for Te Whatu Ora, but being a health promoter means looking further than what my role is. So looking across all sectors in Aotearoa. And that's, you know, and that's talking about high level. Then again, because we're talking about planetary health today, now we have to consider what's happening around the world and not just look after our own little village here in Aotearoa. So my second question is kind of moving into that space. So a week ago, the participants were sent some really significant documents. So you had the Geneva Charter, the Sao Paulo Declaration on Global Health, and the Wairau Statement. So how have these documents impacted health promotion? What changes or benefits have they prompted? What does that look like at a grassroots level for many of us here in Aotearoa? And how can we use these documents in the future? Because high level stuff is sometimes hard to connect to. Do you want me to repeat the question? The last bit?
No, that's clear as mud, Mariana. I like the fact that you asked the three type questions, you know, the one that starts with the trunk, but then it has many branches and twigs and leaves and all of that. Let me try to tackle first. If it gets complicated, as I have done already, I'll pass it on to Mariana. Firstly, what is planetary health? You mentioned planetary health. Planetary health is about the health of the planet. And there are two parts to that. The health of Mother Nature itself, Papatuanuku and Ranginui, as well as the health of us, you know, anthropos, Homo sapiens, mere mortal beings. That's what planetary health is all about. It's addressing the health of the planet, and it's about our human systems, our political, our economic, our social, our financial, our cultural systems. You know, the human-built aspects of our life. And then there is the natural systems, Mother Nature, the water, the air systems, the ground, the soil, the sea, and all of that. And we are at a point of huge crisis, as you know. And that's why planetary health has come to the fore, and it's becoming more and more important for all, including health promoters. But the history of how we have come to this point, we can go back to health when it was at a local level, and then national health, and then we move up to international health, and led, of course, by WHO 1948, and after World War II, when there was the realization that it's no good looking after your own room. We are all connected, our rooms under one house. So we need to look after our own, not together, our own planetary home. So hence international health. And then we talk about global health. That's when we realize that many of the challenges are global in nature, but they impact directly on the local level as well. But now we have come to the point to realize that it's not just about humans. In fact, we humans are the cause of all the challenges that we are facing today, whether it's geopolitical conflicts, whether it's economic crisis, whether it's pandemics, whether it's ruining, you know, our one and only planet. And that's planetary health. But let me highlight, because as you mentioned already, the title of our workshop is how Aotearoa is shaping world health promotion. And I'd like to highlight at least 5 points, and we can look at the details later on. And then we can continue our conversation. And I'll pass it over to Viriami. The first thing that we have done here in New Zealand is that joined the global accreditation scheme of the International Union for Health Promotion and Education. And at the same time, our unique Te Tiriti-based and our knowledge systems have been incorporated into the global framework for us here in New Zealand. So we co-benefit from being under a global accreditation scheme, one system across the world. And at the same time, IUHPE, under its global framework, has acknowledged our own unique context here in New Zealand and our historical context. And IUHPE is very interested in what we are doing because this is the first accreditation framework that includes indigenous knowledge. No other country in the world has done that. And so there's great learning for IUHPE, and IUHPE has asked the Health Promotion Forum with its leadership, but it's a collaborative effort to learn from our experience and to share it across the world, especially countries where there live the 400 plus, almost 500 indigenous population. The second point where we have shaped and influenced well health promotion is our contribution to the latest WHO Charter, the Geneva Charter for Well-being. We have actually contributed indigenous knowledge and leadership. We put in ecological well-being and spiritual well-being. If you read closely the charter, and I hope that our participants have read it as well, you will see indigenous knowledge and planetary health and ecological well-being and spiritual well-being, peppered throughout the document. That was part of our contribution directly from the Health Promotion Forum, but also through the International Union for Health Promotion and Education. The third contribution that we have made is actually to include indigenous knowledge, to enrich planetary health, and to put it through two legacy statements from our World Health Promotion Conference in Rotorua, and put it to IUHPE, the International Union for Health Promotion and Education. And it's now embedded to its strategic direction. For example, the 5-year strategy of IUHPE, you find planetary health, indigenous knowledge, spirituality in it. The fourth one is actually the establishment of a global working group called Waiora Planetary Health and Human Wellbeing as a working arm of IUHPE to lead, to advance, and to implement the two legacy statements that I mentioned earlier, two of the outcomes from the Rotorua conference. And a fifth achievement and contribution to shaping well health promotion is my being elected as the current president of IUHPE. All those things are, of course, related, and it came from the effort, the collective effort of us here in Aotearoa. Some of you might have participated in the Rotorua conference. That was a turning point for health promotion and planetary health. Turning point in the sense that for the first time, planetary health is registered in the radar and the thinking of IUHPE, rather than focusing only on social determinants of health. And for the first time, planetary health became one of the determinants to focus on. And the definition also of planetary health from our work at IUHPE is not just the scientific definition from Western science that is evident in the Lancet Commission statement of 2019. We also incorporate the two Rotorua statements, understanding of health promotion from an indigenous perspectives. In other words, health promotion, planetary health is not new to indigenous thinking and indigenous peoples. We have also input to other areas like the Planetary Health Alliance to the Sao Paulo Declaration in 2021, but it all came from our collective effort here in Aotearoa, which came to a climax with our hosting of the defining 2019 World Conference on Health Promotion. We co-hosted with IUHPE. Our colleagues from IUHPE, they came, they saw, and they were convinced. And they went back and we continued the conversation. And they agreed that it's time to include planetary health, but also equally important, for all, not just us, indigenous perspectives on health promotion and planetary health. You know, in those 6 of 7 points that I mentioned, we have certainly contributed to shaping health promotion at the local as well as the world level. And we continue to have this ongoing dialogue with WHO, with IUHPE, of course, but also with Planetary Health Alliance and other such sister organizations working at the international level. I thought that I mentioned these things, but we will drill more into it more deeply. And I have forwarded the other parts of your 3 questions that you asked. I'll pass it on to William to contribute as well. Yeah.
Sione, and I think you covered most of the points that we need to discuss, and I'll let the panel digest that, and then there may be ask further question. I just want to add on that, you know, we may be small here in New Zealand, but we can walk tall, precisely because we so happened to be in the time when we got a lot of support. And it really helped our cause when the government of the day declared the wellness budget. And that's sort of wake up the people from other countries, while everyone is so keen and thinking about themselves and how much they can make and invest on you know, the financial thing, and you know, looking at GDP and all that. New Zealand declared that they pay attention to wellness, and that's really inclusive of just not the health of the people, but the things that determine the health of the people. And so it's just happened in such a time. And we're very fortunate, our little team. Indeed, we're very small. I think we were only starting off by like 7 of us to think of inviting this global meeting to come here to New Zealand. But the point that I just want to make here is that certainly the saying that we stand now on the shoulders of giants, it happens in what we did here. There were so many people going before us, and it really helped us because there are many, the tourists, the government, and you know, and everyone was rallying behind and around, and we may be the face of the actual events on the day, but certainly the atmosphere, the environment in New Zealand allows us. It was very proportional. They empower us, enabling us to do what we're able to do. And I think that's a very important point, that we can do just about anything, really, regardless of our size and our resources. But when we work together and when others support us, when we collaborate and accept our limitation and ask others to help us, we can really do a lot of things. So I think that's just the point that I want to add on there, Sione. Malo.
Yeah, thank you, William. That's an important point, and I'd like to touch on that one. You know, to the timing is right. When St. Michael Mahmoud prepared his talk for his keynote address for the conference, we had a Zoom conversation, and I mentioned in passing to him, I thought he was aware of you know, the well-being, broad well-being framework, not just GDP, that the current government put in place to inform not only its budget but also broadly economic policies, fiscal and social and so on and so forth. And he highlighted as one of the the clear signs that New Zealand is kind of ahead of the game. And the Deputy Prime Minister, Grant Robertson, was invited to speak at the WHO World Congress on Health Promotion December last year, where our small team was invited to present as well. And the focus was on well-being, which is an understanding that health and well-being is broader than just economic well-being. And Dr. Mihi Ratima was also invited through our invitation to speak at the conference. But as you said, we are not walking alone on this. We value the collaborative effort, across the motto. We are followers of those who have trailblazed this pathway before. And as you know, Sione Santuri, Echang Professor John Raven, Sir Colin Tukutonga, and Aotearoa, of course, and others, and the late Moana Jackson, were people who have been supporting us over the years in this pathway of focusing on the broader understanding of well-being rather than economic well-being. And we also need to acknowledge our co-workers across the world, Professor Tony Capone and Dr. Sandro Di Maio in Australia, and of course, Dr. Trevor Hancock in Canada, and Professor Margot Parks, and many others across the world. And so we value working together. As they say, if you want to walk fast, you walk by yourself. But if you want to walk far, let's walk together. We will come back to this, a very big topic, especially for the interest of the participants, if they want to ask more of that. But we'll come back to you. Mirama.
Kapa, yeah, thank you for that. So, we've started to go into the whole indigenous health promotion stuff now too. So we're creeping into that section, which is good. So we've got a good question here from Danny McLean. I hope I said your name right, Danny. So this person asks, o ngā mihi korua he pātai tāku, the current health reforms offer structural changes to our national system. What opportunities do you see for us all to leverage this to embed a stronger health promotion approach in Aotearoa, especially indigenous health promotion? So I'm going to ask that of both of you. Who'd like to go first?
I'll go first, and then Viriami. I think there are a few opportunities, but there are also lots of challenges. The reform has an intention of going more into the communities and have a collaborative partnership of working together. But it's a space that many public health services do not fully understand. But I think, the iwi, the hapu, the whānau, they know that space really well. So there's a need to have a mutual trusting relationship and to learn from one another. One of the observations of WHO of New Zealand is that we are ahead of the game in terms of working with communities, addressing inequities, and working with indigenous peoples. And I think this is an opportunity for the public health services to learn from iwi-based providers, whānau and communities, and rangatahi as well, and the NGO sector. I had a conversation with Sione Santuri, as you know, the mastermind behind Whanawara, and he made it clear that Whanawara is health promotion because it's about building the capacities of the communities themselves to manage, to own, and lead their own health and well-being and their destiny and their future. And so there are already many tools that are in place for us to use. So the strength in the community, acknowledge that and work with the communities. The second opportunity that I see is to influence the current workforce plan to build the capacity of the workforce. There is a need to slant it more towards public health, and this is not my bias, and health promotion as well. And some of you might be familiar with the submission from Boyd Swinburne and others, and Sir Colin Tukuitonga, to look at the capacity of the communities, but also to remember that the failure that we face is because of the investment on only 20% of the healthcare system. The other 80% is actually public health and the well-being of the community. And we need to focus more on that to build our public health capacity and our health promotion capacity. My information is that we are trying to do that, but I think a more collaborative effort with the NGO sector, who are more independent and work closely with the communities to work together towards that. And the change that needs to happen, as the question has put it, it should not be just a structural change. It should be more a cultural change. Not only the change in the finance and the brick and mortars and the organizational structure, more importantly, how we do things together. It's the culture, it's the ethos, it's the value system that informs how we work things together. We have seen this reform 20 years ago, and it was the best of intentions. It has not saved certain sectors of our community. This is an opportunity to make it work this time around. So those are my contributions. I will pass it on to William.
Sorry, trying to unmute myself. Yeah, thank you, Sione. And I think pretty much the things you said, it's all what it needs to be said. I just want to add on that again, thinking about health promotion, of course, our really the central issue or central theme of health promotion is empowerment and uplifting and awakening the goodness that's already within people and community. And we talk about indigenous thinking. So it's not just doing, but also the thinking behind everything we do. It's really the not just the science, but the science and art of building community. And it means it's not just the mind, but also the heart. And I think in our work, especially with Māori and Pacific, we are heart people. Unless you touch the heart, the mind will not think about it, and the hands and feet will not move. So I think this is really the essence of what we are trying here, that we must not just spend all the time in what's logical and what's balance in terms of our books and budget and all that. Thinking, it's great to do the right thing, but we must do the right thing and do it right. Because we can do the wrong thing right. So it's really, really the thinking and the commitment to build each other and to build a community. That's the heart of indigenous health promotion, as well as the health promotion itself. I think that's all I can say at this point, Sione. Thank you for all the good corridor that you have shared.
Kia ora, thank you. I'm just going to quickly give my 2 cents. So for those of you listening, if you haven't come to our webinars before, you'll notice that, especially Sione and William, because they sit at those seats, there's a lot of name dropping and a lot of big names. And if you've worked in the health field before, you'll know that it's notoriously political. So it's important for us as health promoters, or people who work in the public health sector, to learn who the big heavy hitters are, who the big players are, because it is a political arena. And if you want to achieve something, sometimes you're going to have to enter into that political space. And so the names that you'll hear from Sione and William are those, they're very high level, those high level figures. And so for us, for us mere mortals who are, who are maybe probably, not too far in our health promotion journey, it's important for us to figure out who they are, who these people are, and how we can show support, where we want to get involved, and how we can advocate for the causes that we want to represent. So I just thought I'd chuck that in there because sometimes, the names can, people don't know who you're talking about, Sione and Viliami. So just throwing that in there. Some of you probably we all know. Okay, we're going to move on to our next question. We're still on the kaupapa of Indigenous health promotion. So you talked about, Sione, you talked about this national accreditation framework, and you talked about embedding Indigenous or Māori knowledge into a scheme that's across the world. So can you, for our listeners, can you quickly describe what this is? Because there might be some people that might want to sign up for this, they can be a part of this. So can you explain and describe that, the National Accreditation Framework?
Yes, thank you, Mariana. Firstly, health promotion is an unregulated profession, practice. It is not registered and regulated like teachers, lawyers, social workers, nurses, and doctors. Partly because it's a more recent development. It's a newcomer, to the block, as they say. And while it's great that anyone can walk in with their current set of skills and work, there are a few risks there. One is that you are vulnerable. Two is the risk to the community. Those are the two things. And of course, the need to standardize the quality of the training and acknowledgement of a standard, qualification and code of conduct for that matter. And so IUHPE is moving towards that, not to regulate at this point, but to formalize more and to give more public acknowledgement to the efficacy of the profession, but also to give recognition and more credibility to the practitioner. And so we decided to join that on the condition IUHPE accept our own component of for the accreditation, and that is to have Te Tiriti as part of it, and also the social, political, cultural context of New Zealand. There was a bit of a negotiation of 2 to 3 years, but in the end, they saw the importance of having that because the diversity across the world, but also the increasing recognition of indigenous knowledge across the world. I mentioned earlier how it has been incorporated to IUHPE, that is indigenous knowledge, and also WHO, but also in many of the other specialized agencies of the World Health Organization and the Secretary General of UN itself, Antonio Guterres. They all talk about it's timely to bring indigenous knowledge and leadership to the party and make it central. And so we are now a member of that global framework. In addition to the global framework that is largely based on the Ottawa Charter, IUHPE has accepted that we develop our own components based on the Te Tiriti and the other components I mentioned earlier, and be included, and that's unique for us. And they will learn from that. So what's the benefits for the workforce here in New Zealand? The benefit is that you will be recognized more formally. We will have a register. We will offer ongoing training, easier for employment opportunities and all of that. Of course, salary, promotion negotiations, and all of that. But more importantly, the consistency of the training and therefore the practice across the module. And it will be across the world, with this global framework. Now the timeline, by June next year, we will have the organizational structure and its resources set up. and funds permitting from our main funder, Aotearoa, now we call the provider Aotearoa now, and we will operationalize the accreditation framework. We will offer assessments, and of course there will be current skills evaluation. If you have come with your degree or years of practice, that will be automatically registered and so on and so forth. So definitely by early 2024, the system will be in operation. It will give more recognition to health promotion practitioners. It will give recognition to education providers who will offer health promotion qualifications and accredited by IUHPE. And I'm sure the president of IUHPE, the current president, will see to it that we drive this and make it happen by the time frame, provided we have, money and all of that. And so the benefits, as I said, one other benefit is that indigenous knowledge, Mātauranga Māori is included. And so we have a workforce that has got the best of both worlds of knowledge, but also our co-workers across the world will learn from what we are offering. And again, that one way of understanding how from here in Aotearoa we have contributed to health promotion at a global level. You will maintain your registration on a 3-year cycle. Like other professions, you will do an X amount of hours of professional training. Our health promotion forum, workshops and other offerings will be shaped partly to cater for that ongoing professional training needs. So, it's good to be part of this, and let's work together. And I'm sure when we begin to roll out more information, we will certainly welcome and value, feedback from the workforce and also members of the health promotion forum. But Anna, that's a start. But
that was good, nice.
Would like to add to that as well.
I just want to add for the listeners that Sione did mention specifically Māori, but also Pacific and Asia. As part of our health promotion forum work, we also cater for, to be indigenous is not just Māori, but also Pacific and Asian and the whole diversity here in New Zealand. So you can imagine the amount of work that we need to do so that we can recognize all the different diverse group, ethnicity and otherwise here in Aotearoa.
Kia ora, yes, and also just for our listeners as well, I chucked up in the chat, we do have a Indigenous Global Working Group. So if you, and we would really like to see you, if you want to be a part of that, then flick me an email. My email's in the chat as well, because we are rebuilding that network and we want to increase our numbers. So starting off in Aotearoa. So have a look at that in the chat and email me. Get back to me about that. We need you. All right, we've got a couple more questions before we move on to the next section. So first one is, how are other Indigenous peoples faring regarding health promotion in their homelands?
The short answer, they are not faring well compared to us. Take the case of our fellow workers in Australia, the Aboriginals and the Torres Strait Islanders. As you know, in general, their lifespan and status of health and well-being is, 10 years, at least 10 years behind overall. And that's because of, the sweep, harmful, force of colonization and institutional racism. And so we are ahead of the game compared to Australia. Similarly, in Hawaii, with the indigenous Hawaiians, and again, in the US, it's worse there, and in Canada. They are in reservations and negotiations for land to be apportioned, to be given back is still at its early stages, but there are some 476 million indigenous peoples around the world, Mariana, by the last count, and 80% of our biodiversity on land are kept, on land settled or where indigenous peoples live, despite the onslaught of colonization and discrimination against them, and that's what has woken up the UN system to look at the unfairness of not only of the lives for these fellow human beings, but equally, if not more, equally important is the well-being of the planet. Because as you know, in certain parts where it's concentrated, where indigenous peoples are, like in the Amazon in Brazil, the lungs of the earth, it's the indigenous peoples who are the guardians of these precious, parts of our fauna and our flora. In the Pacific, it is the same, although slightly better. And Viriami might say a bit more about it, given that Viriami, with his at least a decade of professional experience working with the Secretariat for the Pacific Community, SPC. Viriami?
Yeah, thank you, Sione. And I think that's a very good point that you are. If we are comparing, if you're looking at other nations, we can be very proud of ourselves of what's happening in Aotearoa. But just like anything else, when we look within our society, of course, we see the inequity and a lot of issues. Again, the indigenous population, be it Pacific, Māori, or even Asian, still doesn't have the great health outcome that we're all entitled to and aspire to reach. So there is a lot of work that needs to happen in that way. And I think one of the things that we are trying to do here in Health Promotion is to mobilize ourselves. I'm actually the current president of the Indigenous Professional Health Promotion globally. And as Mariana was calling out, hopefully, and beginning next year, or beginning today, actually, if you're listening and you are Indigenous and you want to champion this cause, this worthy cause, I would encourage you to get in touch with Mariana, because we really must improve. We cannot say that we are better than Australia or America or something like that. Where we are, it's not good enough. Malo.
Kia ora, thank you. Okay, I've got a good question. I'm just going to go up. We've got a question come in from Donna Campbell from AFS. So Donna asks, do you think having Te Tiriti-o Waitangi alone has been the catalyst towards better outcomes for Māori? Who wants to go first?
I think that question is for you first, Mariana. Anyway, I'm joking. You'll have a share of this because you are the Māori health promotion strategist, and we need to hear your voice. But also, this is not just a space for males; it's for women leaders as well. And there might be some other members of our team who would like to contribute to this. I'm not putting people on the spot, but I'm inviting them to the rest of our team to contribute.
Oh, you guys go first, and I'll give my 5
Yeah,
cents.
certainly, Te Tiriti-o Waitangi, is a leading factor in these changes. A change that, a transformation that has taken many decades, and lives lost and resources taken and all of that. And there is the historical aspect that people say it's past, but look at the legacy, look at the institutions, look at the value system, look at the policies that are in place, and look at the health statistics. It shows very clearly that we still have a long way to go on this. And Viliami was right. We should not say that we are better than our sisters and brothers across the world, especially the indigenous communities. We are in this together, and I might divert the conversation for us that, it's about us working together across the world, although we need to focus at home at the same time. But certainly Te Tiriti, and before Te Tiriti, of course, the Independence Declaration of I might show my ignorance of our history here. 1839. I stand to be corrected on this, off the top of my head. The independence movement, because of the concern among tangata whenua of the increase in inappropriate ways of the settlement communities and the appropriation of land in unethical and illegal, ways and all of that. So certainly it was driven by tangata whenua, but also more recently in the past few decades, we see people who see, this is the abuse of human rights. The injustice to the part is injustice to all. And so we acknowledge that as well. But I agree with the questioner that it was Te Tiriti who has driven, a major driver, behind all the changes that we are facing today. But we still have a long way to go.
I think just briefly add on to the point you're making. I think it just so happened, just the way the indigenous people think and act, it's just very much in line with what the whole world finally realized that that's the way to go. It's really about sharing. It's really about collaboration. It's really about the collective. Just look back at we're still in the pandemic, and the need for all of us. It doesn't matter where you are from or what you're doing. Disregard how much money you have or how well educated you are. The virus doesn't have any respect, and the only way we can survive is to work together, respect each other. Those kind of behavior, it just come naturally with the way the indigenous people live and act, and therefore, I think the whole world suddenly realized, there are all these ways that have withstand the test of time. Why don't we maybe pay some attention and learn a thing or two from them? So I think that is very, very important from the indigenous perspective. Malo.
I'll turn the table towards you, Miranda.
Yeah. We've just got someone who has to shoot off. Kei te pai, Rob, thank you for joining us. And we've got another question come through, but I'll just shoot off to my answer to that for Donna's question in terms of Te Tiriti o Waitangi being the catalyst towards better outcomes for Māori. I do think it's been a huge tool for Māori to be able to, because it's what their intention was. It was a strategy to help protect Māori and at a hapu-based level. So I do think it has become a very important and probably the most important tool for Māori to get better outcomes. But I think that's been over a process of time. So it wasn't, not all Māori signed the Te Tiriti. So it has formed some tensions along the way. So with Ngai Tūhoe, who didn't sign the treaty. And so that, their clash with the Three Waters thing happening at the moment. So I wouldn't say that it's been great for everyone across the board all the time. And I don't think it's the only thing that has attributed to better outcomes for Māori, because there are lots of different efforts that different Māori have and non-Māori have fought for, that doesn't necessarily doesn't come from Te Tiriti or Waitangi, but I do think it is the best tool that we can use to work and to honestly to get leverage of the government to get better outcomes, because that is what we need. We need something that we can use to leverage off. Like, there are countries out there that don't have a treaty, and what does that mean for them? You know, what are their struggles like because they don't have this agreement with the Crown? So yeah, that's my answer. Yes, but not all the way, Donna. I hope that makes sense. Kia ora. We're running out of time. I know we do have to go on to the next session, but I just want to ask this. So we've got one more question around indigenous come through, and that's kia ora, who will guide the whakaaro around Te Tiriti in the accreditation framework? Which is a good question, Rhonda. That was going to be one of the next ones as well. So how does indigenous knowledge feature in the accreditation framework? And which health promotion guidelines could inform this, such as two hands? And is this something the Indigenous Network will be helping with? So I'm going to fling it back to you two.
Yeah, very good question.
Yes.
Firstly, we look at Health Promotion Forum itself. It's a mainstream organization that is grounded on Te Tiriti, and its approach is a partnership approach, trying to talk and walk a pathway of partnership informed by Te Tiriti, and that is reflected in its trust deed or its constitution. It's worth looking at. It's on our website. Secondly, it is reflected on its organizational structure. There's a 50-50 membership. 150% is for Tangata Whenua, and the other 50% is for others. There's a seat there for Pacific, as well as another seat for Asian. And there's a provision by the trustee for the forum to gauge the changing nature of our demographics and all of that. And so basically we can't do anything without being informed and guided by Te Tiriti. And that goes to how we recruit, our staff. We also have a kaumatua, Bishop Richard Wallace. And we have a Te Committee Māori, on the board, in addition to the 50-50 membership. And so our work is being guided by that. This work on the accreditation itself was led by our senior health promoter who has left us last year, Trevor Simpson. Trevor is now Māori advisor to Pharmac, but Trevor is also the chair of the Māori reference group of the Health Promotion Forum, and Trevor now also sits on the academic reference group that is the first port of call for the unfoldment of this work on the accreditation framework. In other words, Trevor led this work and left it with us, and it's our duty to implement that. We will continue to seek guidance from within and without as well, from for example, from the Māori reference group. And now Merana has got the wonderful bounty of leading that work. So Merana is your first port of call, but you can also ask questions to me, and I can convey it to the board if I cannot answer. And there might be other brilliant ideas of how to implement this. But right from day one, we are aware of our constitutional responsibility, and we continue to walk and on that pathway. And looking into the future, the implementation of the accreditation, again, it will be guided by those processes and by the institutions that are in place for us, the board, the Kaumatua, and staff who are Māori, as well as external advisors like our Māori reference group. The health promotion workforce has been consulted over the years on this development, but it's good to be asked, and also that to remind us, but also that we be open to other ideas, and we might call on you, to contribute to this. I hope, Rana, that I have touched on the key points of the question, but Liami
Yes,
might
yes.
want to.
No, I have nothing else to add. I think that's very clear.
Oh
Malo.
yeah, I'm gonna give just my 2 cents too for Rhonda. So we do a lot of work with Stir Rhonda. And we also have, so like Sione said, we do have Māori reference groups and stuff like that. In terms of the Indigenous network, I suppose that would be more so because we're leading the way in that in terms of what we're doing here. So I guess what we'd do with that network is show them what we're doing and help them to guide what they would like to do. Because I know it's really, really different for the First Nations of Canada and for the Aboriginal people from Australia. So in terms of that network, that's how we would influence that. But if this is to everyone, if you are interested in being a part of our Māori network as well, I haven't put that up in the chat. I knew there was something I forgot. Then please email me. I have had some people email through their interest to be part of the Indigenous network. Awesome, love that. If you want to be part of the Māori network here in Aotearoa, please email through to email me. Whānau, I'll forget if you just put it on the chat. So you have to email me, and then I can get back to you too. So thank you to those that have let me know that they're keen to jump on.
Thank you, Miranda.
Awesome.
I didn't realize that we are allowed commercial breaks during the session. I might plug in.
I'm allowed. I'm
membership.
allowed. When I'm the MC, I'm allowed.
When you have the talking stick and the chair roll, wonderful. But I'd like to highlight one example of the work of this network. Our Indigenous colleagues and non-Indigenous colleagues from Canada, they came to Rotorua to our 2019 conference. They were very impressed with the work that we were doing, not just how the conference was run, where Te Reo was an official language in addition to English, French, and Spanish, and the prayers at the beginning and everything. It was wonderful, but also the track of good work that has been done over the years in terms of health promotion, Indigenous knowledge here in Aotearoa. And of course, the drive after the conference to set up the global working group and driving the legacy statements through IUHPE in a very positive construction way and collaborative way as well with our colleagues from around the world, and also contributing beyond that to the World Health Organization. So they wrote to us when they were preparing to co-host the latest World Health Promotion Conference in Montreal in May this year, and asked for some guidance on how to go about putting out a similar legacy statement to the tool that we put out here in 2019. And so we gave advice and co-led that process, and we have the Chauchake statement. I'm attempting to say it in the Indigenous way, Chauchake statement. And as you can read in the statement, I take it that it was sent to you among other documents. It addresses the needs of Indigenous peoples in Canada. It acknowledges the good work that we have all done here in Aotearoa, like the 2019 conference, and also addressing the global concern of the health of the planet and the health of Indigenous people as well. So that piece of work was a big contribution from the indigenous network. And as Miranda said, we contribute to our brothers and sisters around the world, both indigenous and non-indigenous. We need to acknowledge those non-indigenous co-workers who work alongside and support this movement. And as William said, it is just the spirit of the age, that humanity has learned that we have to work together or we perish together. And Mother, Papatuanuku will continue to live and we disappear from the face of the earth. That's how things are if we continue our human follies. I'm debating, I realize that. Miranda, back to
Yes, you are. Okay. Okay, we're going to move on to our next section. So thank you for your questions, everyone, and thank you for answering those, Sione and Vilami. So we're going to move into the planetary health section. So first question is, what does planetary or world health mean? Can you explain what that means for the everyday person? Can you give us a simple explanation? Because I thought I knew and I didn't even until recently. So can you break it down, make it easy for us, please?
I think we have attempted at the outset to keep it simple. It's the health of the planet because we are a planetary community now. And it's addressing the health and well-being of the planets, and it's addressing the human systems. That's one major component. Our political structures, our economic structures, as you know, our economic structures and systems are not actually contributing to our well-being and the well-being of the planet. Not only that we have a huge inequity, but also we create material wealth at the expense of our spiritual well-being and the denuding of our one home, Mother Earth. So that's the human systems we really need to work on. And the other equally important component is the natural systems, the air, the water, the trees, the soil, and all those 9 or so earth systems. Some of them, they have been pushed beyond their sustainable boundaries. And it's very clear, global warming, for example, the latest COP27 in Sharm el-Sheikh in Egypt, just a few weeks ago, political leaders and economists and environmentalists and other scientists trying to negotiate to maintain the level of, global warming at 1.5 and all of that. So the health of the planet and the health of humans together, that's what planetary health is. And as I said before, Mariana, if it's still complicated to us, we just remember that indigenous peoples, know a lot about planetary health because in their worldview, we are one with the planet. We cannot be separated. That's an everyday simple understanding, but very accurate understanding of what planetary health is. Humanity and the planet is inextricably one. And it's about sustaining that balance, maintain the well-being of both the natural system and our human system. That's a start. I'll hand it over to Williami because Williami gave that elaborate
Can I ask you the next
earlier.
question, Williami? Can I
Sure,
ask you the next
sure.
question? So the next question was, what support does the Pacific people in Aotearoa and back in their home islands need in regards to planetary health promotion? What are their priorities right now when we look at planetary health?
Yeah, thank you, Mariana. And I think as Sione has tried to explain, when we talk about planetary health, we are talking the whole system, and of course we human have been so focused on us, and and we just begin to realize that actually we are not able to exist without everything else around us. So we're beginning now to pay attention to those things, but still the main purpose of our taking care of them is so that it will take care of us. This is also true to answer the question you are asking. We need to move from just focusing on us and to respect other living beings and other things that support our life and our health. We all of a sudden we realize that the trees, if no trees, it would be no people. I'm reading now a book by Alan Westman, and it says that the world without us. And it's very interesting because he described that actually the world will quickly restore itself when human being disappeared. And actually, the world will not miss us at all. And actually, the world will do better. I mean, the rest of the planetary beings, be it trees, rocks, and ocean, and whatever. So I think what is important here, with regard to the Pacific, the whole issue about climate change is not a scientific discussion. It's real life experience every day. Small islands, I was in Tonga when the eruption of the sun was blocked out in midday. I mean, we thought that it was the end of the world, and the internet was disrupted, and we didn't know, and the rest of you guys will probably think we disappeared from the earth, but a lot of those things here. What the Pacific needs is for other nations who contribute more to the problem to also help become the solution. And I think again it goes back to the idea that we are all in here together. And even though you might think of the small islands is not important, but whatever you do in any other part of the world will also, the ripple effect will occur or will echo in other parts of the world. I mean, I think the pandemic is a very brilliant example. Regardless of where did it started, all of us share the consequences, and only by working together we can overcome and continue to survive together. And I think that's the simple message from the Pacific and from the indigenous people. Really, it's just to have some respect for others and respect for the things that sustain our lives.
Thank you, Viliami. I forgot what I was going to say, but I'm going to go on to the next question. So on top of that, on top of knowing all of that, so we're looking at the planet, the health of the planet. We here in Aotearoa are a small country at the bottom of the world. The islands are even smaller. We contribute less than 1% to the world carbon dioxide emissions. So how can we get the world to listen to us? What can we do from our desks and from our homes here in New Zealand? What is to contribute? What is the first thing you would do? Sione, you can go first.
Yeah, the first thing I'd like to say is that smallness, it's one of the words that you use. Smallness is a state of mind. It's a state of mind. Yeah. One of my uncles, he's known as a poet more than his academic work, Appere. However, Viliami knows Appere well. He said that yes, smallness is a state of mind, and he gave the example how the colonizers came into the Pacific and divided us up and say, that's your island, that's your small island, that's your small island. you Tongans live over there, you Samoans live over there, Fijians, you Kiwis, and Tangata Whenua live over there. Whereas actually before, our reality is the vastness of the moana. We sail, we trade, we love one another, we sometimes fight, and we trade. And the biggest ocean, 1/3 of the world, the Moana Nui Kiwa, is our continent. It's although an aqua continent, as William's late brother, termed it. But that's how big our world is. We were not limited, our thinking to the defined definitions of others. We know what vastness and how to think big and act big. So we should not be limited by the sheer smallness of the physical landmass that we are on. What is important today is actually the thinking, because the thinking, we are global citizens now. We only have one home, small planet Earth. And what matters is the thinking of the mind and the thinking of the heart, or in the late Dr. Mohino Blocher's words, the thinking of the heart and the feeling of the mind. And we share those thoughts and those ideas and those innovations across the world. Similarly to when in 1986, adjunct Professor John Rayburn, one of our champions and great colleagues and very close friends of the Health Motion Forum, he was in Canada when the Ottawa Charter was evolved, and he contributed community development. Similarly to when Mihi Ratima and Alison Blacklock and John Rayburn again were in Bangkok at the Bangkok Charter, and they contributed indigeneity and spirituality as well. And similarly to how our team here at Health Motion Forum and our global working group contributed indigenous leadership, indigenous knowledge, planetary health, spiritual well-being, ecological well-being to a charter now, which makes us become one of the architects. We are inside the whare, so we should continue to design our global whare and not to be scared by the fact that we are a small, remote, distant, small island, at the bottom of the earth. No, it's if you take a perspective from our side of the world, we are actually not only at the center, but we are actually at the top of the world. We can see everyone, and we can contribute to everyone. But humor aside, the serious message is that it's about working together. Firstly, in our country, let's clean up our own whare, because we still have a long way to go, but also offer our experience to the rest of the world. And we together can help to make the planet a livable place again. Otherwise, what William said will be fulfilled.
Thank you, sir. And Mirana, if I just may add on, Sione just reminded me, as individual people or as individual islands, every time I go to the islands, I encourage them, don't be so worried about what the big countries are not doing, but focus on what you yourself can do and what you should be doing. When we think about a percentage of our contribution to the air pollution and all that, then we say, oh, we don't contribute much, but we still do contribute. And, be mindful of throwing away plastic bottles or tin or buying things with the excess packaging and things like that. And if you are able to grow your own garden and do recycling and reuse and do all the right things that needs to be done, regardless of how small it may be, that's where the solution lies. It's not just waiting and comparing yourself to others, but what you yourself can do, you should continue to do that. I make it a practice. Every time I see an empty can and I have a friend who's collecting that, I'll pick it up And I make it, I used to ask people that in every day, just determined to pick up 2 pieces of rubbish that you didn't throw away yourself. And you know, and as you walk around and stuff like, so we have to come down to that level, be it you individually or a family or a small island or small nation. We must continue to do the right thing because it's right to do the right thing. Malo.
Yeah. And again, on smallness, you know, the leaders of the small island nations of Kiribati and Tuvalu, they are the most vocal ones at these meetings, world meetings of COP, the latest one in Egypt as well. And so they don't actually, they care about their small nations, but they also care about the rest of humanity. And as to where you start and when you start, you start now and start where you are right now. You know, if you are at the top of the mountain, if you are in the beehive in Wellington, make sure that all policies are healthy policies. If you are with the whānau, make sure it's a whānau ora, not a whānau mate. You know, work on the well-being of the whānau. If you work with our tamariki, do a good job on that. And just raise your consciousness, elevate our consciousness that we are in this together. That's what health promotion is about. As William said, everyone can make a contribution. And so for the health promotion workforce across the country, whether you are in a remote, you know, small hamlet in the South Island, or whether we are in Auckland with its traffic jam, we are all working together. And the forum is a vehicle for us to join up. And the work that we do is what we can do. You know, put policies, put frameworks for training us, connect with international level. But we are in this together. And what we all do, you know, we think, you know, systems thinking, you know, as indigenous peoples and as Kiwis and New Zealanders do. We see the whole picture. That's one of the advantages of being in Aotearoa, New Zealand, because we can see the rest of the world. And we can see the connectedness of all things in life. And we can work together, whether you are at the top of the mountain or down the river, upstream or downstream. We are in this together. You know, if you work within an organization, if you work in an NGO, or whether you're in the public policy, just make sure that whatever you do is for the well-being of all and address inequities. And it's about the well-being of the planet and the well-being of us, you know, members of the human, you know, family. I think that's what I can contribute to that. Diana.
I'm going to have to cut you off soon because we're nearing the end of our time. But I thought what we could do is before we have give last words, is that we could do our photo now, Emma, and then Viliami and Sione can finish off with last words, and then I'll do karakia to close us off. Is that all right?
Ka pai.
All right. So what that means is, whānau, show us your lovely faces. Oh, kia ora, Brianna. Kia ora. Got some ex-students in the whare.
Wonderful.
All right. So Emma's going to give us the instructions, whānau.
On the count. 3, 2, 1. Beautiful.
Jeez.
Thank you very much.
Lovely. All right, we've got 1 minute left. So I'm going to invite Sione and Viliami just to, you know, their last words before we wrap it up. And then we'll go into karakia. So any last things you'd like to share before we close off, Viliami and Sione? Over to you.
Yeah. In other words, we were talking about how we build our capacity, you know, to save Aotearoa, and for those who can, you know, save the rest of our human, you know, family. And so it means not only that we build our skills and our knowledge, but more importantly, you know, our attributes. It's about how we work with justice, with love, and with care. You know, as they say, they won't care how much you know, unless they know how much you care first and foremost. And it's about saving all, not just a sector of our whole community. It's about working together, not working alone. And it's about being strategic and systematic and have a lot of patience and fun and laughter. That's my final words of wisdom, Mirana. I'll pass it on to Liami.
Thank you, Sione, and Malao Pito Miliana. And I think there is a lot that we can say, and we have said a lot as well. And I think I'm just thinking of one of the great words that we heard through the ages, that what we are really aiming at is to have some change. And what more can we do but to be the change that we want to happen? And I think this is really, really something that we are at our own rate, at your own ability, just do the things that you can do. And never think that that you cannot do anything. Never underestimate the power that is within you. And I think one of the things that we do in health promotion, we do talk a lot, and you can see that, you know, both of us, bad luck for you that we can really talk a lot. But one of the things that I often thought of and always think about, that really the message that we are telling, whatever the theme and the topic, it's just as important as the messenger. The message and the messenger ought to be one and the same, meaning that we have to walk the talk. And I think that's the final word that I would share with you. For all of us, whatever it is you're thinking, just put it into action and help others to be able to do the things they themselves would be able to do. Malo Abito.
Kia ora korua. And just last little word from me before karakia is that a big takeaway for me listening and having everyone here is that is to offer our wisdom to the world, and that's what I'm going to do. I'm going to push to get indigenous knowledge not just recognized in Aotearoa, but recognized globally. And I just want to remind you, this is my opportunity again to say, if you want to come support, then let me know, contact me, so we can have, the more voices, the stronger we are. So yes. So that is the end of our session, everyone. Evaluation, if you could please answer those 3 questions and get those into the chat in the next minute, that would be great. Or what else can they do, Emma? Is there another way they can get back to you?
They can email them to me.
Oh, there you go. You can email our wonderful Emma Frost with your evaluation comments. All right. Wonderful session. Thank you, everyone, for joining. I'm now going to close us off with karakia and have a rest of your lovely day. Ka inoi tātou. Kia tau kia tātou katoa, te atawhau tō tātou ariki ai hukaiti, me te aroha o te atua, me te whiwhenga tahitanga ki te wairua tapu, ake, 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 amene.
Amen.
Mauri ora whānau, thank you for joining us, and I will email you soon.
Aotearoa. Thank you, everyone.
Malo. Merry Christmas, everyone.
And end recording.
Where's that? Recording time. Stop.